Managing Flexibility in Early Years, a time-wise presentation working in partnership with Leaf Nurseries and the Early Years Alliance. In this video, we'll show you how to manage flexible working requests, key considerations, and what we can learn from other hard-to-flex sectors. Firstly, let's consider there are two types of flexibility. Formal flexibility, which is fixed and usually written into an agreement or contract, and informal flexibility, which is agreed with management and can be temporary or occasional. When handling flexible working requests, there are 4 steps you should follow. Firstly, consider, is this a formal or informal request? Remembering, if this is a formal request, you will need to follow your own company's HR processes. Is this a request for a temporary or a permanent change to ways of working? Once you have established that, you can consider how you might balance the needs of the nursery with the needs of the child and family and the needs of the individual. Then discuss with the individual what is the request and see if and how it could work. Here is an opportunity to also discuss alternatives and any trial periods you may want to consider. And finally, you would accept or decline the request. If the request is to be declined, ensure the reasons are clear and the message is delivered with compassion. We often find that there are concerns around fairness and consistency with flexible working. Remember, it might not be possible to accept every flexible working request, but by applying the same principles of balancing the needs of the individuals, the nursery, and children and families, it will enable you to act fairly and consistently. Here are some key considerations to enable you to find that balance. What are the implications for the nursery? Are there any impacts on occupancy rates, ratios, staffing levels, or costs that you need to take into consideration? How might it impact you and the rest of the team? Are there responsibilities that might need to be picked up by other members of the team? Is it an opportunity for other members of the team to take on some more responsibility or to work in a different pattern themselves? And how might it impact the children in both positive and not so positive ways? What options are available to address the impact of granting the request? For example, this could be an opportunity for another member of staff who would also like to work flexibly to consider a job share arrangement, or to consider sharing some of those responsibilities, or to consider taking on additional hours. If you cannot grant the request, do you think you might be able to in the future? If you are going to decline a request, the individual is going to be disappointed, and that has the potential to make them feel disengaged and demotivated. Is there a way that you could consider this request for the future, or are there other options to provide this person with some more flexibility so that you can maintain their levels of motivation and engagement? Finding a way to balance the needs of everyone will allow you to make decisions on flexibility. Here are some case study examples of flexibility in the early years sector. In this situation, flexible working was used as a retention tool. Scarlett, a level 3 practitioner, found that working 5 days was affecting her mental health. She approached her manager to say she was thinking about leaving. Scarlett's manager did not want to lose her and so discussed the situation with her, and they agreed to try a 4-day compressed working week for a 1-month period to see if that helped. Following a successful trial period, the new working pattern was formally agreed and written into Scarlett's contract. Scarlett is still at that nursery and is now a room leader. Here a manager had to consider a formal flexible working request. Chantal is a level 2 practitioner who submitted a formal flexible working request after her maternity leave to reduce her hours to 3 days a week, Monday, Tuesday and Wednesday. The nursery manager reviewed staffing levels and occupancy rates, and based on this, offered Chantal an alternative 3-day pattern, working Mondays, Tuesdays, and Thursdays, which was accepted by all. And finally, an example of informal temporary flexible working. In this situation, a level 2 practitioner approached her manager to request temporary shorter shift patterns to care for a relative as they recovered from surgery for a 6-week period. The manager took the opportunity to speak with all team members to see if anyone was able to cover the additional time needed, and together with the use of a bank member of staff was able to accommodate the request. The level 2 practitioner, again, remains at that nursery, is committed and motivated to continue working at that nursery and progress their career there. They were examples from the early years sector, but what could we learn from other hard to flex sectors? Flexible working in the NHS. The NHS has set a strategic intention of we work flexibly, including targets for the percentage of roles to be advertised and undertaken flexibly. Here are some of the ways that they have introduced flexibility. So self-rostering. Teams are able to choose shift patterns up to 6 weeks in advance, and teams themselves are responsible for ensuring safe levels of staffing. This provides staff with input, stability of working patterns, and advance notice of when they are working. Another example is the any hours rota. So for every rota, there are 2 unfilled shifts that are opened up to any hours. Here, midwives can choose to work any hours within that shift that they want, which is booked via their existing rostering system. And that is because people said they were willing to take on additional hours, but not full shifts. This has meant every shift pattern is covered. Midwives have the additional hours that they need and want, and the ward is at safe staffing levels. And finally, agile working. For some, the ability to work remotely for training or administrative tasks has been implemented. Flexible working in construction. Again, another hard to flex sector. Here are some examples of ways that flexible working that have been introduced. The 2-team flexible rotation model. So Team A finishes early in week 1, Team B finishes early on week 2, and each team provides cover for the other. The use of technology to enable more remote working. Systems now allow reports to be completed off-site, which means occasional home working can be done for specific activities. And finally, pod working. So here, people with the same skills or qualifications form local pods that enable them to cover for each other at different locations or sites, and that creates a rotating flexi day. For those people who were taking part in the programme, they saw a well-being improvement of 35%. We know from our own research that flexible working supports better health and well-being. It improves levels of engagement and job satisfaction, and it makes it easier to attract and retain good staff. Make a start today. Flexible working is difficult in early years, but it's not impossible. You can just start by opening up the conversation. Talk about flexible working with your team, your line manager, and other nursery managers to see what is possible. And remember, when faced with a challenge, a team will often find the solution themselves. Ask your team or your team of peers to consider how you could offer more flexibility. What would need to be different to make it work?